Hi, my name is Madeline Reese, and today I'm doing my presentation on Lyme disease. Lyme disease is an infection caused by Borrelia burgdorferi, a spirochete bacteria that is carried by infected Ixodes scapularis, or deer ticks. As the tick bites the human skin, it inserts B. burgdorferi into the body, then the bacteria travels through the skin to the bloodstream. From there, it can induce a number of systemic issues by spreading to nervous tissue, cardiac tissue, and joints. B. burgdorferi binds to certain receptors to induce a pro-inflammatory response that creates an erythema migrans rash and flu-like symptoms. Lyme disease is classified as a zoonotic bacterial infectious disease because it is transmitted to humans by an insect. It is the most common vector-borne zoonotic disease in the US. What I think is really interesting is that based on tick life cycle patterns, we know that humans are most susceptible to these tick bites in the late spring into the summer. So it is especially important during that time of year to wear bug protectant for Lyme disease prevention. Most cases of Lyme disease are in the Northeast region and the Great Lakes region of the US. Lyme disease in other countries is caused by a different species of tick, so not the Ixodes scapularis. About 90% of those affected by Lyme disease will recover from the disease within 4 to 6 weeks after they are treated with antibiotics. But the other 10% develop post-Lyme disease syndrome, or PLDS. Some also call it post-treatment Lyme disease syndrome. PLDS is characterized by symptoms of fatigue, pain, and difficulty speaking that last more than 6 months after antibiotic treatment. The defining clinical manifestation of Lyme disease is the erythema migrans rash, which appears in about 70 to 80% of Lyme disease cases. It is a circular red rash that forms at the site of the tick bite sometime between 3 to 30 days of the tick bite infection. The average, though, is around 7 days. As the rash grows larger, parts of it clear and it begins to resemble a bullseye. The rash may feel warm, but it is generally not itchy or painful. Other clinical manifestations include fever, chills, headache, muscle and joint aches, and swollen lymph nodes. If left untreated, early-stage Lyme disease can evolve into stage 2, and these clinical manifestations can develop within days to months after the infectious tick bites. These manifestations include severe headaches and neck stiffness, more erythema migrans rashes, facial palsy, which is the drooping of one or both sides of the face, arthritis with severe joint pain and swelling, inflammation of the brain and spinal cord, nerve pain, and more intermittent pain. Lastly, if left untreated even longer, Lyme disease can develop into a third stage characterized by crippling arthritis and neurological symptoms that resemble multiple sclerosis. Lyme carditis is a possible complication of Lyme disease when the infection spreads to the heart tissue. It can interfere with normal heart rhythm, causing heart block. Symptoms include faintness, dizziness, palpitations, and chest pain. It can be treated with antibiotics, and severe cases may require a pacemaker. Diagnosing Lyme disease is a difficult process. The main clinical manifestation of erythema migrans rash can easily be mistaken for eczema, cellulitis, ringworm, a different insect bite, or granuloma annulare. What helps distinguish the erythema migrans rash from others is its rapid development and prolonged presence. But 20 to 30% of those infected with Lyme disease do not develop the rash at all. Lab tests for Lyme disease are difficult because blood tests for antibodies for B. burgdorferi can show up negative because it takes several weeks for these antibodies to develop. So the newly infected will most likely show negative results. The CDC recommends that clinicians use a 2-step procedure when ordering antibody tests for Lyme disease. First, they should order a sensitive screening test, such as an enzyme-linked immunosorbent assay. And if that result is positive or equivocal, they should order a more specific Western immunoblot test to confirm the result. Again, if the patient is newly infected, both of these tests will still probably be negative. Because of the unreliable clinical manifestations in lab tests, it is critical for the physician to think critically about looking at all aspects of the patient, looking closely at the signs and symptoms, lab tests, and thinking about the likelihood that the patient was exposed to an infected tick. Septic arthritis is a common differential diagnosis of Lyme disease. One of the most common clinical manifestations of Lyme disease is arthritis in one or more joints. Because Lyme disease testing is difficult, it can be easy to erroneously diagnose Lyme disease as something else. Both septic arthritis and Lyme disease can produce swelling and tenderness in the affected joint, but usually only septic arthritis has signs of intense pain. Patients with Lyme disease are more likely to experience arthritis of the knee, and they're more likely to have a fever. All right, and that is my presentation, and here are the sources that I used. Thanks for watching.